Hi, everyone. Good evening. Tonight, we are going to be discussing nutrition and lifestyle and how it can enhance one's fertility or damage it. My name is Shira Yaffe. I'm a women's health nurse practitioner, and I've been working for Genesis Fertility for over 6 years now. Over the years, I've seen the strong impact a couple's nutrition and lifestyle can have on their fertility journey and their reproductive health. For this reason, I have become so passionate about nutrition and lifestyle. Why is nutrition so important for our well-being? Well, everyone knows that our body needs certain vitamins and nutrients to work well. For example, vitamin C. Anytime someone has a cold or is feeling under the weather, they take vitamin C. It boosts their immune system so that they fight off that virus or infection faster. What about electrolytes? Most people think of electrolytes as Gatorade or Powerade that they need to drink on a hot day or after an intense workout. In reality, electrolytes like sodium, calcium, potassium, and magnesium play a crucial role in the heart's ability to work properly. Off balance, and one can develop an arrhythmia or high blood pressure or even cardiac arrest. How about sleep? We all know how important sleep is, but did you know that sleep impacts your heart, circulatory system, immune system, hormones, metabolism? And according to the NIH, sleep deprivation is linked to many chronic health issues like high blood pressure, depression, heart disease, and diabetes, just to name a few. I think my point is obvious. Good nutrition and lifestyle is how we keep our systems working, and that includes fertility. Except with fertility, our bodies need to be working well enough that it feels safe to procreate. Let's put it this way. If your body feels that it's in survival mode, it will not have any extra resources to conceive and support a pregnancy. I like the analogy of being chased by a bear. And I bring that up many times in practice. If your body is perceiving this, the only goal it has is to make sure that that bear does not get you. That's it. But here, the goal ultimately is to give our bodies what it needs nutritionally and in our everyday habits to feel safe. The first thing I want to discuss is what key nutrients enhance our fertility and where can we find them? What nutrients do we need to help our body work the best way possible so that we have regular menstrual cycles, not too heavy, not too painful. A man's semen analysis is normal. The sperm parameters are optimal. We need to fuel our bodies so that it can work like a well-oiled engine. And guess what? When doing so, not only do you enhance your fertility, but you also feel better because our body systems are not separate. They're all connected and they all impact each other. So when you optimize your fertility, you really are increasing your health as a whole. Keep in mind that most of what I will be speaking about in terms of nutrition applied and lifestyle apply to both male and female fertility. So let's dive in. Let's talk about macronutrients versus micronutrients. Macronutrients give you energy. Examples of macronutrients are protein, carbohydrates, and fat, while micronutrients support your body systems with vitamins and minerals. We need larger amounts of macronutrients versus smaller amounts of micronutrients. I'm going to start with micronutrients that support fertility and move into macronutrients and how to balance them a bit later. Please keep in mind that there's only so much time that we have. And so please look at my book recommendations at the end of the webinar for a more in-depth analysis. The first micronutrient I'm going to discuss is choline. Choline is an essential nutrient that plays a big role in a baby's development early on. Neural tube defects, congenital abnormalities, and even a baby's cognitive development is influenced greatly by a mother's choline stores. The recommended intake is 425 milligrams of choline a day for women in their childbearing years. However, many prenatals don't even contain choline, let alone the recommended dose. That's where our food comes in. The best whole food source for choline is egg yolks, liver, and organ meats. One egg contains 115 to 150 milligrams of choline, while liver contains 119 milligrams per ounce. Omega-3 fatty acids is another nutrient that eggs are rich in. Together, choline and omega-3 have been shown to enhance fetal brain development. Another food that is high in omega-3 is seafood. Our bodies do not produce omega-3, so it is vital that we get enough from our diet. Omega-3 fats are essential for our brain, heart, and vision health, and has been studied to improve egg quality, sperm quality, and assist in hormonal balance. This is one of the reasons why omega-3 is recommended for women with PCOS. The recommended dose is 250 milligrams or more a day. Vitamin B12. Vitamin B12 supports sperm and egg quality, reduces DNA damage, and balances inflammation. Animal products are the best way to get most sufficient amounts of vitamin B12, specifically organ meats and shellfish. Folate, also known as vitamin B9, is important for red blood cell production and repair of DNA, but it is most commonly known for its role in preventing neural tube defects and other fetal abnormalities like spinal bifida. It is also a crucial vitamin for egg quality and early embryonic development. Most think that the richest source of folate is leafy greens, when in reality, beef liver contains 3 to 4 times more folate than the same amount of leafy greens. A 3.5-ounce portion of beef liver contains 426 milligrams of folate. I feel at this point I should just get into liver since we have mentioned it quite a lot already. According to Lily Nichols' book, Real Food for Fertility, liver far surpasses the nutrient density of all fruits and vegetables and even most animal foods, particularly in its concentration of choline, iron, copper, zinc, vitamin A, vitamin K2, folate, and other B vitamins. It truly is God's multivitamin. Liver is also rich in vitamin A, another super important vitamin that supports fertility. Inadequate intake is linked to fetal defects and malformations in vital organs that develop in the very early stages of embryo development, which is why it's so important to have adequate stores of vitamin A while trying to conceive. Vitamin A is also crucial for testosterone and sperm production, ovulatory function, egg quality, and progesterone levels. 3 to 6 ounces of liver a week is sufficient to give you the micronutrients you need to support fertility. Iron, another nutrient abundant in animal products, including liver, is regulated through vitamin A and other nutrients like B vitamins, zinc, copper, and folate. Anemia is something we really want to avoid when trying to conceive. It is linked to ovulatory infertility, thyroid issues, preeclampsia, and preterm birth. Many people opt for iron supplementations, but I find that most experience unwanted side effects like constipation, not to mention that our bodies absorb iron better through real food. For many patients who are experiencing anemia, I recommend eating more iron-rich foods like beef liver or taking beef liver capsules as an alternative to iron pills. Iodine. Iodine is a trace element and is a crucial mineral for women in support of their thyroid, breast, and ovarian health. Deficiencies have been linked to a high risk of pregnancy loss, maternal and neonatal thyroid problems, congenital hypothyroidism, and severe intellectual disability, according to Real Food for Fertility. And again, it is very important to have optimal stores before conceiving. Iodine-rich foods include seafood, seaweed, full-fat dairy, and eggs. So far, we have spoken about eggs, liver, fish, and dairy as good sources for many of the micronutrients mentioned and more. I have another fertility-supporting food that I'd like to mention. Fermented foods. Our gut microbiome has a direct link to our hormone health, digestive health, immune function, and mental health. As I said at the start, our body systems are intertwined. Fermented foods are a great addition. They're easy to digest since they are already partially broken down from the bacteria and yeast that fermented them and contain healthy levels of probiotic to support our gut and vaginal microbiome. For example, kefir has lower lactose levels than traditional dairy, and sourdough has lower glycemic index plus a lower level of gluten than traditional other breads. Supplementing is sometimes necessary, but it is important to know that you can get sufficient amounts of probiotics from food sources. Before continuing on to macronutrients, I think it's vital that I discuss fruits and vegetables. Green leafy vegetables in particular are amazing sources of folate, vitamin C, vitamin K, beta-carotene, fiber, B vitamins, and trace minerals. Cruciferous vegetables support estrogen metabolism, and fruits contain many antioxidants, including vitamin C, that have a great effect on sperm morphology. Macronutrients. Okay, so to review, macronutrients are large food groups such as protein, carbohydrates, and fat. Protein would be eggs, chicken, meat, fish, and some dairy products. Carbohydrates include bread, pasta, sweet potatoes, just to name a few. And fats would be oil, butter, and tallow. Let's start with protein. Why is protein so important for our reproductive health? Proteins are made up of amino acids. All 20 of the amino acids have a role in our body systems. 11 amino acids are made by the body, but the remaining 9 need to be consumed. Some foods have all of the amino acids that we need, and these are called complete proteins. These are animal proteins. Some foods, other foods, have only some of the amino acids, and these are called incomplete proteins. These are plant-based proteins. Without getting too deep into this, since this forum and time limitations do not allow for it, since plant-based proteins are incomplete proteins, multiple studies reveal that the majority of vegetarians do not meet their protein intake recommendations, nor do they get enough micronutrients from their food. If anyone here listening is vegetarian, I urge you to read Real Food for Fertility by Lily Nichols. She gets into the nitty-gritty of plant-based diets and unfortunately its detriment on the reproductive system. Okay, back to protein. Protein helps regulate blood sugar, the production of hormones, ovulatory regulation, and helps build lean body mass. It is crucial for all steps of fertilization, implantation, and the development of the fetus. According to Applied Physiology, Nutrition, and Metabolism, women need a lot more protein than we once thought. The recommendation is 1.5 to 2.2 grams per kilogram. That means for a 140-pound woman, she needs about 95 to 140 grams of protein a day. The general guideline I give my patients is to aim for about 30 grams of protein at each meal and try to add some more in by snacks. Bottom line, most women are not meeting their protein intakes. Okay, let's move on to carbohydrates. We all know that carbohydrates raise our blood sugar levels. Blood sugar balance is important for everyone to have a healthy body weight and for our hormonal health, which in turn means a healthy regular menstrual cycle and a healthy endometrium ready for an embryo to implant. Our metabolic health greatly influences egg and sperm quality and keeps inflammation at bay. Not all carbohydrates are the same. A sweet potato and a piece of chocolate cake will not be equal. So we want to try to eat high quality, low glycemic index carbohydrates, like for example, sourdough and sweet potatoes. But it is important to eat a protein before or with your carbohydrate. Since proteins, particularly animal-based proteins, do not spike your blood sugar and they also take longer to digest, eating them before or with your carbohydrate will minimize the blood sugar spike from the carbohydrate themselves. We call this naked carbohydrates versus dressed carbohydrates. Try your best to dress your carbs with protein. Okay, the last macronutrient, fats. Fats have really been demonized over the years, but we are learning how important they really are. Of course, the type of fat is super important, and we will get into that, but it is so important to understand the fat's role in the reproductive system, particularly the female reproductive system. One great example is the corpus luteum, Latin for yellow body, aka cholesterol. Our eggs are microscopic and located in cyst-like structures called follicles that are located in our ovaries. Every month, a bunch of these follicles become big enough for us to see on sonogram, but only one becomes dominant. And that is the one that ruptures and releases the egg into the fallopian tube, also known as ovulation. The follicle that releases the egg turns into something called the corpus luteum. This corpus luteum is made up of cholesterol. It produces progesterone and supports implantation and pregnancy until the placenta takes over. This is just one example of how crucial fat is for our diet. The best way to get fat in our diet brings us back to animal protein. Every animal source comes along with a fat. Think about it. Meat, fish, chicken, eggs, dairy, they all have fats. Non-animal sources would be nuts, avocados, and olive oil. Okay, now that we went through the main macronutrients and micronutrients that support fertility, I would like to go through a few common fertility disorders that I see quite frequently in practice and how to support them nutritionally. PCOS. In order to know how to support these disorders, we need to understand what is going on. According to ASRM, American Society for Reproductive Medicine, PCOS is one of the most common endocrine disorders in women, with prevalence up to 15% when assessed with the Rotterdam criteria. The Rotterdam criteria is the most commonly used guide in diagnosing PCOS. A woman would need to have 2 out of the 3 of the following in order to be diagnosed with PCOS. Oligomenorrhea, or anovulation, which means irregular or absent cycles. Irregular cycles would be cycles with intervals more than 35 days apart or less than 8 cycles a year. Hyperandrogenism, which means excess production of androgen hormones like testosterone, for example, that lead to hirsutism, which is male pattern hair growth or hair loss, and acne. And the third, polycystic ovaries on sonogram, which means more than 12 follicles or more on each ovary, or a volume above 10 for each ovary. Now, most women with PCOS have many more symptoms than just the 3 listed above. That can include insulin resistance, increased LH levels, increased AMH levels, infertility, increased risk of miscarriage, and difficulty losing weight. Regardless of body weight, 50 to 70% of women with PCOS have insulin resistance. In other words, it is the diabetes of the ovaries. This is really important, but because there is what to do about it. So let's first understand what insulin resistance is. Insulin is the hormone responsible for moving sugar from our bloodstream into our cells so that our bodies can use it. The pancreas secretes insulin in response to rising blood sugar. However, most of the women with PCOS don't have the regular response to insulin. So that blood sugar doesn't decrease, and the pancreas starts to release even more insulin. Lily Nichols has a great analogy. Imagine trying to put out a fire that keeps burning, no matter how much water you pour on it. Eventually, you put it out, but you end up using nearly 3 times as much water as you should have, not to mention that it takes twice as long to put out, meaning the fire has caused significantly more damage. That is insulin resistance in a nutshell. These consistent high insulin levels wreak havoc on our body and lead to even more male hormones to be produced and affects ovulatory function even more. So what can we do about it? We avoid high glycemic index carbohydrates, or sometimes decrease carbohydrate intake significantly, and we try to maintain a balanced blood sugar throughout the day. That means eating within 1 hour of waking. Please do not skip breakfast. It is crucial for hormonal balance. Not going more than 3 hours without eating, having balanced meals with a protein, fat, and fiber with a focus on high protein to help stabilize the blood sugar, and not having naked carbs. Countless studies demonstrate the difference a high protein, low carbohydrate can make for women with PCOS. One more tip. The order in which you eat your food can make a difference on your blood sugar as well. Eat your veggies, fat, and protein first, then eat the carbohydrate. In regard to lifestyle tips for PCOS, exercise is key. It will depend on what type of PCOS you have, but in general, strength training tends to be the most beneficial for PCOS since, again, muscle helps balance your blood sugar. Okay. Hypothalamic amenorrhea, or HA, is basically no period, amenorrhea. It can happen before a teenage girl ever gets her period. That would be called primary HA, or it can happen later in life and the cycle stops. That's secondary HA. Now, this differs from PCOS because women with HA stop ovulating altogether and usually go 6 or more months without a period. HA accounts for about 30% of cases with secondary amenorrhea, but can be up to 80% among athletes. I really would like to point out that you can be on a spectrum of HA, and I've seen this plenty in practice. The last thing to occur are the cycles stopping for long periods of time, but there are signs and symptoms before that. It can show up as irregular cycles, short luteal phase, or premenstrual spotting. There are three main types or causes of HA, but they can overlap: weight loss induced, exercise induced, or stress induced. Any or all three of these factors can suppress the hypothalamic pituitary ovarian axis, or HPO axis. This is literally the communication system for our menstrual cycle. Suppress it and no period. All three of these are stress, the HPO axis. Not enough calories, stress. Too much exercise, stress. Life events such as deaths or breakups or extremely challenging jobs, stress. The leading cause of HA for most women is an energy deficiency, also a stress. It's either too little intake or too much energy being used. It's really important for women with HA to increase their caloric intake and decrease their exercise and stress. I know it's much easier said than done, and in reality, HA can have its own webinar because there's so much to say on it. But at the end of the day, your body needs more calories with a well-balanced diet, particularly fat. Studies compare women with HA to ones without HA, looked at their macronutrient balance, particularly fat and carbs. Even though they were eating the same amount of calories, the women with HA consumed most of their calories from carbohydrates and stuck to a very low-fat diet, while the ones without HA, who had regular cycles, did not restrict their fat at all. For many women with HA who increased their calories with protein, fiber, and good carbs, plus fat intake, and ate regularly throughout the day, resumed their cycles within a few months. Endometriosis. Endometriosis is chronic inflammation caused by cells from the lining of the uterus to travel to organs and structures outside of the uterus. According to ASRM, it occurs in 10 to 15% of women, but 20 to 50% of women with infertility. The data on nutrition for endometriosis, unfortunately, has not been studied well. We know that diets such as the Mediterranean diet and gluten-free diet decreases pain associated with endometriosis. Since it is inflammation, decreasing other inflammatory foods such as soy, seed oils, caffeine, refined carbohydrates, sugar, and alcohol, while increasing anti-inflammatory foods and supplements like omega-3s and turmeric, has also been shown to have an effect on endometriosis pain. Fibroids. Fibroids are benign growths in the uterus and affect about 40% of women. Although there are multiple risk factors, what you consume can also increase your risk of developing fibroids or increase their size. Soy has a 250% increased risk of fibroids, while alcohol has a 57% increased risk. Vitamin D, vitamin A, iodine, and omega-3 levels also have an effect on fibroids, as do a higher intake of fruit and vegetables. Okay, let's not forget male fertility. What can we do to support sperm health? There are a few factors that we know are harmful. Firstly, poor eating habits, refined carbs, poor quality fats, soy products, processed meats, alcohol, and smoking. Excess vigorous exercise and overheating the testicles can also decrease count, motility, morphology, and increase sperm DNA damage. It would be beneficial to avoid hot tubs and saunas, and also keeping laptops and phones in distance from the testes while trying to conceive. Here we have a bunch of supportive nutrients for male fertility. So we want a whole food balanced diet rich in vitamin A, vitamin C, omega-3s, folate, zinc, vitamin E, selenium, and CoQ10. And here I have a bunch of examples of where you can find them. Let's move on to some lifestyle factors that have a great impact on our hormonal health and consequently our fertility for both men and women. sleep. I think in this day and age, sleep has become overrated, unfortunately. How many times have I heard, I'll sleep when I'm dead? I have too much to do. Well, it turns out that sleep is really important. As I mentioned in the beginning of the webinar, too little sleep impacts literally every bodily system, including our fertility. We need about 7 to 9 hours of sleep a night. Exercise. As seen throughout our discussion, exercise is not a one-size-fits-all. Some women need to decrease their exercise. Some need to stop it altogether in order to get their cycles back. And some women just need to stop high-intensity exercise and focus more on strength training. Every woman needs to find what works for them. However, most studies support moderate exercise 1 to 5 times a week, with researchers showing that vigorous exercisers took much, much longer to conceive. Okay, toxins. So the first one I'm going to discuss is smoking. I think it's obvious at this point that smoking is bad for you. It's bad for your lungs, your heart, your skin. Let's just say it damages every part of you, including your reproductive system. Smoking damages both sperm and egg quality and quantity. The chemicals in cigarettes are also known to damage sperm DNA, decrease testosterone, and cause the sperm to be unable to fertilize an egg. They also increase a woman's risk of ectopic pregnancies and miscarriages. Lastly, environmental toxins such as plastics, phthalates, phenols, and forever chemicals. These are all endocrine disruptors. That means they enter our body, they mimic our hormones, and they throw our endocrine system off balance. These chemicals are in personal care products like makeup, perfumes, and nail polish. One of the first things I do when I see a patient is advise them to get rid of anything with synthetic fragrances in their home. Yes, that means the majority of perfumes and colognes, air fresheners, and home fragrances. According to Shauna H. Swan, data suggests that men whose mothers had high levels of multiple phthalates while pregnant with them had reduced testicular volume and in turn lower testicular function. These harmful chemicals are also linked to PCOS, premature ovarian failure, and miscarriages. Some of these chemicals, like PFCs, are found on nonstick pans, cookie sheets, muffin tins, etc. Opt for healthier cookware like stainless steel or cast iron. What about organic food? I'm going to try to make this simple because I know that not everyone can buy everything organic, and that is really okay. There is so much benefit into making sure our produce is not sprayed with pesticides and glyphosate, and that our animal products are not treated with antibiotics, and our animals eat real food and get to roam. And we know that those animal products have high levels of nutrients. However, there are some things that are more important than others, and like I have said before, doing what you can does make a difference. The EWG, the Environmental Working Group, has created the Dirty Dozen and the Clean 15 in their shopper's guide. These items are either known to be the most contaminated with pesticides or known to have the least amount of contamination. So here we have the Dirty Dozen: strawberries, spinach, kale, collard greens and mustard greens, grapes, peaches, pears, nectarines, apples, bell and hot peppers, cherries, blueberries, and green beans. Those are the products that we know are highly contaminated. And then we have the Clean 15. These are avocados, sweet corn, pineapple, onions, papaya, sweet peas, asparagus, honeydew, kiwi, cabbage, watermelon, mushrooms, mango, sweet potatoes, and carrots. It's important to take it slow when it comes to toxins because it can be really overwhelming. Everyone needs to evaluate their homes and their lifestyle and see what makes the most sense for them. Maybe I have no problem switching out of my plastic food containers and swapping them for glass, but I just can't afford to buy all organic produce. Maybe my best friend felt it was very important to switch out all of her toxic cleaning products, but I felt it was more important to buy organic pasture-raised eggs. No problem. Do what you can because these little steps do make a difference in our health journey. On that note, I hope this webinar was helpful and enlightening. There's so much to learn when it comes to nutrition and lifestyle for fertility, and I hope that you enjoyed. I hope that everyone is successful on their journeys, and if anyone has any questions, I'm going to do my best to answer them. One more thing, Here are my book recommendations. This is Real Food for Fertility, Countdown by Shauna Swan, and No Period Now What, another one on hypothalamic amenorrhea, if anyone would like to have a good read. Okay, so in terms of food aversions, this is why it's so important to prepare your body way before you get pregnant. Um, so when you do have those food aversions, it's not, affecting your fetus in any way. And then once your food aversions kind of dissipate over the course of the pregnancy, you can start to reintroduce them again. But that's why it's so important that while you're trying to conceive, and the recommendation is at least 3 months before, but longer is obviously better, to make sure that you focus on nutrition and all of these nutrients that we spoke about, because once they're in your stores, then we know that that baby is getting everything it needs, before, you're even pregnant. You have it already in your stores. In terms of constipation and pregnancy, fiber is super important. So lots of fruits and vegetables, whatever you can do, and lots of water, because you need a lot more water when you're pregnant. Okay, so I think that there is a fine line, and I also do think that it is specific to one's body. So some people are going to be more affected than others by certain exercises. So vigorous exercise, I would say, the HIIT classes, intense running. Um, People ask me about like Orange Theory. I think you can make that more moderate, but the ones that are going in and sprinting nonstop, that I would consider vigorous exercise. Moderate exercise, let's say just for example purposes, in Orange Theory would be to walk, or to walk on an incline, when you're at Orange Theory for, the treadmill portion, and then do the weight portion. I'm all in for strength training. But the high intensity cardio is really where, the data says that it's not good for our reproductive system. Other, I'm going to say other kinds of exercise like Pilates and yoga, walking, swimming, those are definitely more calm and more beneficial for our bodies, because you're not stressing it in those types of exercises. So here I'm going to say I really, really urge you to read Real Food for Fertility, because Lily Nichols really, really goes into vegetarianism. I don't think that we have enough time here, honestly, to get into it. I really, honestly, I really just urge you to read the book. It's very, very hard to consume enough protein when you're a vegetarian. And so I mean, protein sources for vegetarianism are like legumes and things like that, but it's really, really difficult to get enough protein. So that's a very good question. And again, it brings me back to my point of how important it is to prepare your bodies for pregnancy, because once you are pregnant and you have that morning sickness, it is very, very difficult to get the right amount of food in and the right types of food in because of the aversions. I think that focusing on the preconception portion, and eating the right foods and taking the right amounts of supplements, etc., really preparing your body for it, will take you through that first trimester until you are ready to eat real food again and that morning sickness is gone. In terms of actually dealing with morning sickness, small, frequent meals seems to help a lot, and eating right away in the morning. So whenever you have an empty stomach that morning, that morning sickness, that's not really morning sickness, is just going to get worse. So you really want to make sure that you're eating frequently throughout the day. You eat something right in the morning and then consistently eat something every 1 to 2 hours so that you have something in your stomach. I think it's very possible to get the right type of exercise at home. But I do encourage PCOS type of patients to do strength training. So that means weightlifting. So if you have that at home, great. You don't have to go to the gym for that as long as you have the equipment. So I think that, every once in a while doing like a cardio dance class where, you're enjoying yourself and you get all those good, happy hormones, I think that could be really beneficial. I think when women are doing high intensity cardio, 6 to 7 days a week, that's when it really could affect you. So I think every once in a while you want to do, an enjoyable dance class. I think that's perfectly fine. But it's the consistent everyday type of exercises, or when you're only doing those kind of exercises and no strength training, where it could really become a problem. Um, I also would like to point out that our menstrual cycles do not lie. So if you are doing certain types of exercises and you see changes in your period, um, it's telling you something. Or let's say you know already that you have hypothalamic amenorrhea and you don't have a period. Once you start to decrease your exercise, hopefully it will come back. It does take time, and everyone is different, so there's no way for me to give, an exact timeline, but it will show its true colors and what your body is able to handle. You kind of have to find your sweet spot. Yeah, so like I said before, lots of fruits and vegetables, decreasing, the soy intake, the alcohol intake. Those are, the ones that have really been studied and shown to, really make a difference in fibroids. Um, Besides for that, omega-3s also kind of decrease inflammation. That's also good for fibroids. For sure, pelvic floor therapy is great. You can definitely see a PT for that. Um, in terms of preparing for the next pregnancy, yes, I would say that that's a great idea. Okay, that's a great question. Um, when it comes, really, when it boils down to it, everything you do to support your health does not go to waste. Even if you do end up needing some fertility treatments, regular fertility treatments from a fertility center. Um, Sometimes you don't need fertility treatments. I would say specifically with PCOS and hypothalamic amenorrhea, those are the two I would say that are so intertwined and affected by nutrition and lifestyle that many, many women don't end up really needing the fertility treatments if they really, really focus on nutrition and lifestyle. I think that a lot of people think eating well and having a good lifestyle is at just like an added bonus. It's actually the true medicine. Um, Sometimes, depending on the timeline that a woman wants, let's say she does not want to wait so long for her period to return, or let's say she doesn't want to wait so long, let's say she has PCOS and it does take time for things to regulate, then maybe she'll opt for, actual medication. But many times it just takes time and effort. This is not easy. But unfortunately, our lifestyles, specifically in America, have really declined. And so really putting an emphasis on nutrient-dense food, eating properly for your specific situation, like PCOS, hypothalamic amenorrhea, really getting what you need, giving your bodies what it needs so it does not think it's being chased by a bear. really, really can help. But sometimes you do end up needing the medical intervention. However, I say this to all of my patients, the nutrition and lifestyle changes you made only make the medical intervention work better. It just makes it more effective. So I can tell you personally, I do not remember the last time I bought a plastic water bottle. The type of filter you have is very important. So the typical like Brita, you're correct, does not remove every contaminant from water, but there are many like AquaTrue is just one example that really does remove a lot of the contamination in our water system. And I recommend getting a filter in your house, getting yourself a stainless steel water bottle, or if you'd like a glass water bottle, and just refilling it. I think that's really the best option. Typically, when you come into our fertility center for an initial visit, we are going to test your AMH level, which is anti-Müllerian hormone. That is a kind of a good picture of your ovarian reserve. Other hormones we test are estrogen, progesterone, LH, which is luteinizing hormone, and FSH. And these kind of give us a full picture of how well your menstrual cycle is working, basically, and your ovarian reserve. I think that's the basics in terms of the levels. I don't think this is the forum for that. But when we test them, we would make sure that they're optimal. I think it just takes time. I mean, making sure that all products of conception are, removed or have, you've released them on your own. That's very important because that does release HCG. But it really just does take time, unfortunately. I'm sorry that you're going through that. Yeah, so I think this is very specific to the couple. For example, if they are extremely overweight, they're going to need a lot more time to lose that weight and get into have a good metabolic health. But I would say for a typical woman and a typical man, I would say 3 months is minimum. Anything over that is, better because you just have more time to get healthier. Definitely not replace. I think that supplements can be really beneficial because sometimes we need more than what we're able to eat. But I think that if you focus on a really good balanced diet, really the only thing you can supplement with, I mean, that you kind of should supplement with is a really good prenatal vitamin. And then if you have any deficiencies, so that's where, a really good practitioner comes in where they check for those things. Like, for example, we check for vitamin D levels for all of our patients in our fertility panel. Because vitamin D has been shown to really have an effect on your fertility. We really want them at optimal levels. So that's something that would be an additional supplementation. Another one would be, let's say, CoQ10, coenzyme Q10. I mentioned it for male fertility, but female fertility also very important for egg quality. And so sometimes women who are getting older in their high 30s, 40s definitely need extra CoQ10 because your body naturally loses it as you get older. So that would be another example of something that you would supplement with. I'm not sure about the ubiquinol form. I would have to look into that for you. In terms of the recommended amount, I go according to your age and for women. because as you get older, the quality of your eggs go down. So as you get older, I increase the dose. If someone has, premature ovarian failure or diminished ovarian reserve, they also would be very high up there on the dosing. In terms of men, I would basically recommend it if they have some kind of issue with their sperm or if they are older in age, like above 40. Like if there's something is off in their semen analysis, like their morphology or, things like that, then I would recommend taking the CoQ10. Unfortunately, there's no like blanket statement of what's recommended. It really is very specific to the person. I don't have a specific recommendation for a book. I can look into it for you if you'd like. But I will say lifestyle can really have an effect on it. So doing things that really bring you joy and can really calm you, yoga, acupuncture, these things can really help you while you're going through your fertility treatments.